Healthcare topics you need and wellness tips you deserve, all straight from the doctors themselves. Maayong Adlaw, Cebu. I'm Kriya Padilla-Roleda from CDN Digital together with the hospital at Maayo, and this is Maayong Adlaw, Doc. In the last episode of Maayong Adlaw, Doc, we had a very interesting discussion with Dr. Dapon on teeth grinding. Now remember, you can always check out the previous episodes from CDN Digital's Facebook page, website, or YouTube channel. Now we're back for another interesting episode, and this time this is very timely because a lot of us are actually suffering from stress, may it be from home or from work. But before we head on to our episode, let's watch this video first from the hospital at Maayo Wellness Unit. The hospital at Maayo's Wellness Unit offers a top-of-the-line wellness medical services that promotes more than just healing and recovery, but total wellness. It currently embraces both Western and traditional Chinese medicine procedures, such as the hyperbaric oxygen therapy or HPOT and acupuncture. Here in one of Cebu's bustling cities, Mandaue, the hospital at Maayo is designed to give you the care and services that you deserve. They prioritize your health, put your needs on top, and make sure that you are given a holistic medical experience. For today's episode, we are going to talk about this traditional Chinese medicine procedure. So let's learn more about acupuncture from our guest doctor today. Our guest doctor for today is a multi-passionate functional medicine doctor. From being a board-certified teacher and engineer by profession, a holistic life coach, a clinician acupuncturist, functional medicine doctor, and a yoga wellness consultant by passion, she specializes in many fields of yoga such as therapeutic yoga, dynamic yoga, and hatha yoga. She is a certified yoga instructor from Vida Yoga Teacher Training in Australia and has also earned varied certifications from California and India. She is currently the clinician acupuncturist, functional medicine doctor of the hospital at Maayo, and founder of Philippine Yoga Academy and the Yoga Academy since 2018. Let us all welcome our guest doctor for this episode, Dr. Nefay de la Serna. Maayong Adlaw, Doc. Kumusta?
Okay ako.
You know, Doc, I'm so excited. I'm really excited today because this is the first time for me meeting an acupuncturist, or this is what we call functional medicine doctor. No?
Yes, exactly.
Yeah, so excited kay ko kay first timer good. But Doc, what exactly is functional medicine? Okay, honestly, this is also the first time I heard of it. Can you please explain it to us?
Okay, good afternoon, everyone. I'm Nefay de la Serna, and I'm very excited to be here. Functional medicine is basically a science in the medicine which addresses the root cause of the disease. So it's incorporating all the types of medicine, either traditional or the conventional. So whatever, that's why it's called functional, because you get every bit of those types of medicine and what works well with the current condition of the patient.
Doc, I'm just curious because we know that acupuncture is a traditional Chinese medicine practice or procedure. But how come nowadays it has been embraced already by the Western medicine? How did it come to that?
It started actually way back 1949 when Mao Zedong have this, they call, I think, October Revolution. And the purpose of Mao Zedong opening it to the world is for his political and socio-economic agenda. So he invited few of practitioners or experts from other parts of the world. And one of that is my mentor, Dr. Lilia Palanca. So most of the time, the one that is invited into that event are medical doctors. When they learn the acupuncture, and in that time, when they go back to their country, they made it into, they expanded it all over the world. So
they actually included it in their practice.
Yes, yes. And during that time also, during 1970, there was President Nixon went directly to China to meet Mao Zedong, and there was one of the patient who had a demo with appendicitis using only acupuncture and anesthesia. So it was used by then, and from that moment on, because of the experience of the medical science, the conventional and the Oriental medicine, where the acupuncture is under, that triumph in that day roared the world. That acupuncture
they were
popular.
Probably shocked, no? At the same time, surprised.
Yes.
Shocked, not surprised. But I mean, surprised and amazed with the effect of acupuncture. Okay, that's why they embrace it. But Doc, in the traditional Chinese medicine, how do they see acupuncture actually as something that could heal or cure different diseases or medical conditions?
Okay, so acupuncture is based from the science of qi. Okay, there is this qi. The qi is a life force, a kind of life force. Now, when the basic principle of acupuncture is when the qi is trapped or blocked in the body, when the flow is blocked, disease is formed.
The qi is like the energy?
Yes, okay. It's a kind of life force. It's actually a bioelectrical energy.
Okay.
In my deeper study about it, in our blood, for example, it holds components like the nutrients, the water, and the oxygen. But these three components will not be absorbed by your body without electrical impulse. So that biomechanical thing that's happened for the transfer of these components to our cell to absorb it, that's where the qi comes in. So it's kind of subtle. Sometimes you don't know, you cannot see it in a microscopic thing, but you know it exists.
How about in Western medicine? How do they see acupuncture as a big help for them?
Acupuncture was known before to treat inflammation and chronic illnesses. Okay, so as we know, inflammation is anything that affects the body. The body will do something to protect it because there's a harmful thing that comes in. That's what inflammation is all about. And also, if a person is having a chronic disease, that any medical science cannot determine what it is. Now, the medical in traditional Chinese medicine or in acupuncture practices, we treat using patterns. We treat where the disease is coming from. What is the root of the disease? Like, take for example, if you come to my clinic and you suffer from insomnia, okay, we will trace back what are the things that causes your insomnia. Maybe it's your lifestyle, maybe your activity, or maybe the food that you are taking or stimulants that you are taking. So patterns, we go back to the patterns. Now, in a medical science, they treat mostly the disease using treating the symptoms. Okay, so traditional Chinese medicine uses patterns, Western medicine uses symptoms. Okay, now in a medical science, you use blood work and some digital scan to see the patient, right? So in a medical science, they treat the person in the physical and also in the emotional, but basing on the symptoms. Okay, for the immediate response for an emergency purposes or any surgical procedure. But in traditional Chinese medicine, we are more focused on the preventive and rehabilitation. And if there is an emergency response, like for example, treating the pain of the patient to ease, right? We will use the needle to stimulate the body, to have the body triggers those natural pain relieving chemicals.
Okay, so speaking of needles,
Yes.
what are the different tools that we use when we do the procedure? we have
Basic
your needles.
acupuncture, yes, the needles, the cotton, and then the alcohol, sanitizing, and the acupuncture is most important.
Since again, this is my first time, I'm so excited. Can you show us how this is done, Doc?
All right.
Okay, and now they're ready to show us a demo of acupuncture. Sige, Doc Nify, how do we do this?
Okay, and here in Maayo, the first, when you enter to our clinic, of course, we have here Miss Chiki. Hi, Miss Chiki. How are you?
Hello.
Welcome.
I'm good. Thank you so much, Ms. Nafai.
Yeah, welcome. Yes, welcome to Maayo.
Thank you.
Okay, so today for the purpose of demonstration, I will look to certain parts of your body. You know that you are going to have an acupuncture today, right?
Yes.
Okay. So I will check your pulse and then also your tongue, and let's see what kind of what points will I work with you today.
Are you nervous, Miss? you don't know what she's going to discover from this.
So basically, when you go to an acupuncturist, the complexion, the smell,
Everything is
yes,
being
the
examined.
aura,
Oh, I see.
yeah, we will look, and then how the eyes, you
So
know.
what exactly are you doing now, Doc?
I'm looking. I'm sensing the pulse in her wrist, which is connected to the activity of her internal organs.
I see.
So the depth and
Now
because
she's
this
starting to look worried.
yes, because the poles are really connected to the internal organs, how they function. So in Chinese medicine, we focus more on how the organs are properly working and communicating each other. Because sometimes you may look good, but you don't feel fine.
Right.
So, for example, if you go to a hospital and you have your diagnostic, everything is on the parameters, on the range, but you don't feel fine and good from the inside. So, it means that, yeah, your organs are working properly, but they don't communicate each other.
Right.
So that's where the acupuncture comes in to enhance the communication of each.
This is basic acupuncture. Usually, how long does this last, Doc?
For one session, the whole session, it took 1 hour. But when the needle is on, you can stay the needle for 20 to 30 minutes.
Okay.
But there are also types of acupuncture where you stimulate and then you take it off, just for the purposes
So
of...
there are different kinds of acupuncture.
Yes, from basic to advanced.
All right.
And also, there is for the neuroacupuncture, like
Is that something new or?
yeah, it's a modern part of the acupuncture, like treating those people who have nerve damage
Oh, I see. So where do you put the needles? Do you think
in
it's
the
head?
scalp.
I
Yes,
see.
in the scalp.
Okay. What are the other health problems that could be treated by acupuncture?
Actually, numerous. If you can, it's already in World Health Organization that they have enumerated all types of diseases from infectious to internal medicine imbalances.
So can we say that almost all kinds of medical
Yes.
problems can be treated by acupuncture?
Treated and also finding relief. For example, for cancer patient, instead of using some medication for pain
Yes.
relief, you can use the needle instead. So that's how acupuncture is a complement practices
I see.
to Western or to the conventional medicine.
Is it you're looking for some pressures? Are you looking for some pressures or just
No,
the
no,
pulse?
it's just
okay.
it's just the depth of the pulse and how
All right.
if
'Cause I
there's a deficiency or excess.
So when you find out something, what are you supposed to do next?
I will know what kind of organs or meridians I will work on.
So you
Alright.
have to be focused on something like that.
Yes, yes,
I
because
see.
there are, like what I said, the flow of the chi, sometimes excess, sometimes deficient, right?
So far, what have we found out with Miss Chiki?
With Miss Chiki, okay, the kidney, she might be experiencing a little bit low energy sometimes. Do you agree?
Is that fatigue? Low energy?
Any low energy, it can be fatigue or any lethargy. See, so that's how we can see that some organs are
Not functioning properly,
are not
very
proper,
well.
yes. Also, can I see your tongue? All right, your tongue is quite good looking, but I can see some coating also. So she might be experiencing some dampness. In traditional Chinese medicine, dampness is a pathogenic invasion.
What does that mean?
It means there are other living entity like microbes or bacteria or fungus that is inhabiting in your body. Okay. Yes.
So are you still excited?
Is it good or bad?
Well, we have bacteria all over our body. Okay, so some of it are in our gut most of the time. Yeah, but sometimes when they overgrow, their population is big, especially the bad one. Okay, it creates imbalances.
Of course.
So, yeah, acupuncture is the needle will help you to make your body back into balance.
Okay.
Okay.
So
And
are
I
you
can-
going to
Yes, I can put
stick
now.
needles on her now?
Yes, yes. So, as an acupuncturist, nowadays we don't reuse anymore the needle. All
You
needles.
used to reuse needles?
Yes, before, because of the low supply. Nowadays,
see.
it's all one use only.
Right. How do we clean the needles before? I'm just curious.
That's the question. That's the question how they sanitize it before, according to the practitioner.
Okay.
But today, it's not anymore allowed for hygienic purposes. So whenever you see an acupuncturist nowadays, okay,
They're using the
they should
disposable.
use, okay, they should show to you that the needle is new, because when it's sealed, it's still sanitized.
Exactly. So it's so scary if you're going to
Yes.
use needles from the
And even if,
bottles.
for example, all needles are not used, okay, you have to dispose it all because it's already exposed.
How about these, Doc? What are these?
That's the used needles.
I see.
Yeah, where we dispose, because we cannot just throw the needles everywhere.
I see.
Yeah, we have to return it back to our supplier
Okay.
for
Okay.
proper disposal.
I thought this is what you're going to use to
No,
her.
no. So this is your first time for acupuncture, right? And I can see also that you are quite hydrated because of the cracking of the lips. Yes, and
dehydrated.
a little bit stress on the eyes.
Boy, am I thankful I'm not in your
Yeah.
place right now.
So sometimes the acupuncturist is a bit of a magician and a bit of what do you call that one? The one with the ball, the crystal ball. Yes. Okay, so we will sanitize.
So that's alcohol.
Yes, we will
Okay.
sanitize the points. Can you take off your slipper, please? Just rest lang yung toes. Yeah, sige. I-rest lang imong toes. Yes. Other side, please. In my clinic, sometimes if I cannot put the needle in the body, I put some of it in the ear, because the ear is a separate mapping. It is also a complete
In the
set.
ear, like inside or just outside?
That is
around
outside of the
lobes?
ear,
Okay.
not the
Hello.
inside. Yes. So, like for example, when Miss Chiki come to my here right now, I cannot put some needle here, which is connected to the kidney meridian.
Okay.
I can put it on the ear
So
instead.
there are also some nerves or
Yes,
no?
it's better in the ear because it's near to the brain. And in acupuncture, we are working with the central nervous system. So it's the ear is directly connected to the brain.
Sige, Doc.
All right.
I'm so excited. Tell me if it hurts, because I'm sure that's one of the most common questions the doctors are asked, right? Like, is it painful? Because we're dealing with needles here, right? Okay. How many needles are we going to put on Miss Cheeky, Doc?
All these 10 needles that I'm holding right now.
Right.
When I-
Usually, how many pinakadaghan,
When you have the facial
Yes.
acupuncture, you can have a 50 to 100 needles.
Facial?
Yes, the facial acupuncture.
what does
Okay.
it do? The facial acupuncture.
The needle will stimulate your natural collagen because the micro needling.
Ooh.
Yes,
We want that.
the needle will have a micro tearing on your face, and then when it happens, your body will say that you have to create more collagen to repair it back. That's why you
So is it
glow
like,
afterwards.
Is it like a natural Botox like that?
Yes, it is, but it works well with wrinkles.
Did it hurt?
No, it did not hurt. It actually is.
Tickles or what?
I don't feel anything.
Yes.
Really?
I don't feel anything.
Wow. So for people who are scared of needles, this is okay.
Yes.
'Cause it
The
doesn't
needle
hurt.
is actually very thin. Sometimes
yes, actually,
it's
I see it. Oo.
yeah. It's compared as a 3 strand of your hair.
I see.
3 years strand.
Yes.
So where does that connect, Doc?
This one is for the large intestine.
I see.
Normally, this is one powerful point to increase the blood flow
Okay.
in the body.
I can't
So,
help it. I can't help but make faces. It really doesn't hurt.
No, it doesn't.
I don't feel anything, even when she
Why
wants
do we?
it like that.
Why do we shake
Okay,
it?
I actually turn the needle to stimulate it.
Okay.
So this is also one thing that you should look for an acupuncturist. Sometimes the difference of one acupuncturist to the other is how the acupuncturist can transfer the energy to the patient.
Alright.
Okay.
Are we trying to hit a vein or dili ra po? Just
No,
the skin
these are points that are located in the body. So there are 2 things that you can hit, either the meridian, which is the channel, or the exact point.
Okay.
So this one, I'm putting this connected to the liver. But these 4 points that I'm giving to her right now is just to flow the blood all over the body. So I'm just opening the portal.
Okay. So we're saying that it's not painful, but has there been any patient who has complained bitaw na ay sakit lang gihapon?
Most patients who will feel the pain are those diabetic people,
Why?
because their skin are very sensitive
I see.
to pain.
Okay.
That's from my experience.
But generally, we don't really feel much.
Unless the person has already fear before coming in.
Kay it's in the
Yes.
mind.
Yes,
nila,
it's already in the mind.
Oo. Kaning heat and electric stimulation, Doc, or simulation, what is that? Is that also part of acupuncture?
Okay, the stimulation is used to enhance the effect of the needle, right? So when you use the heat, here's the thing about acupuncture or the Chinese medicine, it deals about the balance, right? The opposing energy. So when the person is in a cold, so he needs some heat, right? So if it is a yin deficiency, she should have some yang stimulation, right? So the heat stimulation is used to counteract the cold. So there are people, for
see.
example, who have cold hands, sweaty like that. So you need some heat stimulation for that.
Okay.
Now the electrical are more on pain relief. Like if the nerves are already damaged, then you need the electrical impulses to supply again so that the nerve will be activated.
Okay. Sige, so you're done with your hands.
And then
Your
some with the
feet.
ears.
How about there? Still no feeling? Wow, amazing.
So sometimes the ear, okay, when I see the ear, I can see some discoloration, some bulging in there. And that's where the most part that I put the needle, because it means that there is imbalance in that part. Okay, so you can compare the ear as a fetus. Okay, so it's a complete mapping.
Doc, are there any risks involved in getting acupuncture?
Minimal risk, especially in the face, because people sometimes are having hematoma. Yeah, but it's a very minimal. Acupuncture is considered as non-invasive. It's the most safest of all. Even though you prick the needle, still non-invasive, because you are touching the limb, the anterior and the hind limb. So it's still on the muscular level. It's not anymore in the vascular.
Okay. Sige, so let's finish up Miss Cheeky now. How many? 1, 2, 3, 4, 5, 6. That's a 7. Okay, a little more.
When I was a first acupuncturist, I was told that a great acupuncturist can use a lesser needle, then that's it. But as I go along, it depends on. So the problems that I saw in her, in the kidney, I put it in the ear. Yeah.
Is she going to feel anything right away after 20 minutes? Oh, you tell us later, Miss Cheeky.
Yes.
Are the effects, Doc, instant, or does it have to be
for
gradual?
people who have pain, they can immediately feel the difference, like a relief. Most of my clients who have pain, when they visit, after the session, they feel the relief immediately.
So we're going to check on Miss Cheeky after probably our interview, siguro. Humana po na siya, no? Okay, so we will just leave it like that?
Yes.
Okay. All right, sige. So sige, Miss Cheeky, you just smile there while I talk to Dr. Bitaw, Doc. So you mentioned earlier very minimal ang risk, and one of the risks is mona hematoma.
Yes.
Other than that, Doc?
Non-recurring. Yes.
Wow.
Only the benefits.
Oh, amazing.
Numerous benefits.
But can we avoid hematoma?
Yes. It actually depends on the acupuncturist, how gentle and how knowledgeable she is to manage the face of the client.
So it's a telltale sign that if the patient had hematoma, that it's a telltale sign that the acupuncturist maybe is not that good yet.
Yes.
Well experienced. Okay. How do we prepare for each session? Like si Ms. Cheeky now, did she have to do anything prior to having this?
Preferably when the acupuncturist is working with the body, you should wear something that is off the knee. Okay, because most of the points that we are working are in the exterior limbs.
So either shorts or skirt for women, no? Okay.
And also the mindset that you are not afraid of that.
Because again, so Ms. Cheeky said she didn't feel anything, but if you conditioned your mind that, you know, these are needles, I'm gonna get hurt. Oh yeah, right.
Fear alone. Fear alone can hinder the flow of energy.
Is it expensive, Doc?
I don't know if it's expensive in some establishment, but the price that I have here in Maayo is very reasonable, because you don't only get the treatment, you also get the diagnosis, the recommendations, and the treatment. So it's a three in one. That's why the price is like that. But for in other practitioner, it depends on them how they will rate the session.
If somebody is suffering from a medical condition, how often does he need to visit an acupuncturist? How many sessions is he supposed to undergo?
Basically, if it's just a minimal condition, 5 sessions is okay. And then if 5 sessions is okay, and if it's already part of if for example, for a cancer patient that she needs a lifetime support for the condition, then every time that she needs to alleviate the pain, then acupuncture is a must. So it's really not that you will be dependent actually to the acupuncture to alleviate you from the pain.
Okay, so it depends on the medical condition. All right. So how about for healthy people? Usually, how often should we visit acupuncturists?
For healthy people, there are options that if it's part of your self-care routine, then you can just visit once or twice a week, once a week or twice.
Oh, that's still often.
Yes,
no?
yes,
once a week. Often.
Yeah, because you don't know that what happened to your body, even how healthy you are. You know, some healthy people that I know who are very active, but they are bursting of energy, and they have to tame the energy back into balance again. I've known one person who is very active, who is very healthy, but he has a problem of taming the energy.
What happens when your energy inside is just raging?
You are overstimulated, like overjoyed.
Is overjoyed bad?
Yes, in Chinese medicine, because it weakens the heart.
Oh, it does. So we should be very happy.
Yes, anything that is over is not good, of course.
So stoic now is the thing. Just kidding. Okay, how can we tell, Doc, if it's working or not?
First, with the client. The client's testimony, if it's working on her or not.
As the client, how could I tell that it's actually working for me?
And how you feel.
Especially if I'm already healthy.
Yes.
I'll start off healthy.
How you feel. We are working on how you feel.
Okay, so what are these telltale signs that, it's working?
Okay.
First,
if you are healthy, and then if you know that acupuncture is good for you, first, at how you feel, if you feel good. Second is your aura. Your aura will change.
You'll be prettier?
Well, maybe. Yes. And you become active. You
get rid of these fatigue.
Yeah, any discomforts from your body, and then you feel balance from within.
All right. Okay. Doc, what are the do's and don'ts after you get an acupuncture?
So after the session, it is advisable not to get wet at least 4 hours. And then during the session, you must avoid overthinking. Just like when the needle is there, you are expecting something, the needle will be like this, overthinking while the session is on. Because the overthinking will also hamper the flow of energy.
The effectivity of the procedure.
Yes.
Okay. Is it something that's used also for weight loss?
Yes, there are, especially the auricular at the ear. There are points in there that will suppress your appetite. Yeah.
Oh, she got interested too.
Yes. So there, not only appetite but also addiction. Because sometimes your tendency of overeating is an emotional disturbance.
Right, Doc.
You find comfort in the food.
So let's say, Doc, your problem is na overeating, or you want to lose weight. How often should we visit you? Obvious kayo, mga na yung gusto. How do you do that? How often?
For the weight loss thing, there are actually needles that it can be put in your ear for a longer period. It can stay up to 15 days, and you just stimulate it whenever. Yes.
Really?
So you can also visit me for once and then put the needle and then bring it home, and then you just stimulate it.
So the needle is going to look like that?
No, it's a different needle that
Okay.
I use.
You'll be walking around with those needles stuck
If you
out
have
of your
seen
ear.
some Hollywood stars, okay, some needles are very stylish.
Okay, Doc, is acupuncture also like acupressure? Is there a relation between the two?
Yes, the relationship with the two is because they are hitting the same points. They are the same points. The difference is the stimulation. The acupressure is more focused on the muscular thing, while the needles is hitting the nerve
What exactly is acupressure, di ay?
It's putting some pressure on the points.
So it's
just like a
massage?
massage. Yes, it's like a massage.
Okay. Do you do that also?
Yes, I incorporate it in,
so it's part
for example,
of
as
the procedure.
As a procedure. For example, if I need to, after I get the needle and they feel some numbness, so I use the pressure to support the session.
So, in Maayo, okay, do you also offer just plain acupressure?
No, I have ventosa. Acupuncture is just part of the traditional Chinese medicine, right? But here, when I do in Maayo, I do ventosa, I do tuwina massage. That's also part of the traditional Chinese medicine. And electroacupuncture, of course.
Let's talk about them, Doc. Let's talk about the things that the hospital at Maayo Wellness Unit, right? The things that they offer, the services that they offer. Sige, let's talk about them one by one. Okay, we're still waiting pa man for Miss Chicky. So you mentioned about ventosa.
Is the things that I'm offering. Because I don't know the other wellness. I'm not
here
familiar
at Maayo.
The other wellness practices that they offer. All I can share is what I'm giving as a services. But I know that Maayo is the first hospital to incorporate both the conventional and the traditional practices and complementing each other and how it can serve well to the clients or to the patient.
Ventosa is a kind of massage also.
Yes, it's an upward pull massage. So when you go to a massage, it's always downward, right? The advantage of ventosa, it's an upward pull, and it's also effective in getting the panuhot. Yeah.
Is there other word for panuhot? Kung sa ato panuhot na. How about in other places? What exactly is panuhot?
We call it sometimes in Chinese medicine as crazy air.
Crazy air. Lahi po ng flatulence, Doc? Kanang sa tummy?
Flatulence is, yes, it's the same, but it's only here in the belly.
Limited there. Panuhot is like all over the body, right?
It's the air that is traveling within your limbs.
How do we get that panuhot through ventosa?
Well, the ventosa thing will suck it up.
What do you use to?
There is a ventosa glass, or ventosa. Nowadays, there is a plastic wherein you don't need some fire anymore. It's a no fire ventosa.
All right,
But for people with panuhot, it's still good with the fire because the fire and the water are opposite forces, right? So it's a main thing in Oriental medicine that opposite create balance. That's the main principle.
But the ventosa, Doc, no, you end up looking like a ladybug at the back.
Yeah, but we call it pétiché. Right? So that pétiché is a sign that your blood is flowing nice. So if there's also discoloration in those pétiché, that's also, we can tell what is the main organs that needs attention.
See. Okay, so it's not just massage; it's really also like diagnosing.
Yes.
Wow.
That's
amazing.
That's how Chinese medicine is.
But the thing is, ang ventosa is done sometimes sa kaning regular na massage lang, and they don't really diagnose. They just do that, no? So it's better if this is done in a wellness center, no? Like also with a professional like you, Doc. Okay, at least you'll be able to diagnose, right?
It's like people who do acupuncture, but they don't know the meridians. They just do dry needling, putting some needles everywhere.
There are such?
Yes, the dry needling techniques. We call it dry needling because it doesn't use any specific points.
And now it's time for us to take out the needles. Yeah, I'm excited. Sige, Doc, let's take out the needles from Miss Chicky.
I will take the just from.
Promise, Miss Chicky, ha, basi nag-agwanta lang ka, you really don't feel anything. Mamugos gid ba kay nahadlok jay ko. I try it. Okay. Even when she takes it out, wala gyud.
Make pressure, I think, because makili mga something is taken out. Hindi siya
painful. Okay.
So sometimes other clients, when I take out the needles, there are blood coming out. It's a good thing because it means that the energy that was trapped was out. Yeah.
Okay. Alright. Wala may blood. So wala ni go out in
Naa siya blood
energy
sa
that
ear.
was trapped. Okay,
There is
naa
blood
may
in the
sa
ear. There's blood in the ear.
Okay. Ooh, look at that, Miss Chiki.
But you don't have to worry because once the needle is taken out, immediately the pores will go back again to close. So not all parts are having some blood, only those parts that needs to rebalance because it's a sign that the energy was trapped and right now
Okay.
it burst out and then it's what's released.
All right. So, Miss Chiki, tell us how you feel right now.
Yes, so I think I feel relaxed from earlier. Maybe because, as we mentioned, it's my first time to do acupuncture, so I have this idea in my mind that it might be painful or I really don't know what the effect will be. But after Doctor 5 put the needles in, as you said earlier, it's nothing painful. You don't really feel anything. And then when she explained the benefits and what you usually feel after that, so my mind became clear while I was sitting here with all the needles in. And now I feel more relaxed, actually.
Amazing.
So I hope that the effect will be felt longer even when I sleep later tonight. I will feel relaxed.
Will she be feeling that way?
Some patient will have a heavy feeling afterwards because it needs a little more time for the energy to flow, or they were overwhelmed with the flow of energy that the body is not used to. So when you feel that one, it will lead you to sleep. Yeah. Some also will have a burst of energy.
Which is the case in her problem. Or do you feel that way?
She's relaxed.
I
relaxed.
feel more relaxed than having a burst of energy.
Okay. So kanang murag mo sleep ka na. Okay. Okay, thank you, Miss Chiki.
Thank you so much.
All right, Doc, we have learned so much from you today. This is really an interesting episode, okay? Something special, something different. We showed our viewers today how to do the acupuncture in a session. Any last words to our viewers about acupuncture?
When you visit Maayo, try to visit the second floor executive suite where we have our acupuncture session. Acupuncture is very helpful to complement into your medical conditions. So whenever you feel a little bit tired, a little bit heavy, a little bit restless, then even if you're healthy or not, you can try acupuncture anytime. And we are just here to help you to be Maayo.
Thank you both of you. And Doc, hopefully we can see each other for my first ever acupuncture session.
I will be excited to be at
you,
service
Doc.
to you, Ma'am.
Thank you, Miss Chiki.
Yeah, thank you, Dr. Pai.
Namaste.
Thank you very much for joining us today. And of course, please do share this episode to your friends and family so they may also learn from our discussions today. Now, from their promise of Maayo, which in Cebuano means be well, discover a new healthcare experience right here in Cebu at the Hospital at Maayo. If you want to learn more about the Hospital at Maayo, please visit their Facebook page or their website at www.thehospitalatmaayo.com, or better yet, call these numbers below. I'm Priya Padilla Roleda from CDN Digital. See you again next time.